Hello. Can I help you? Oh, you actually came for your appointment. I see, got it. So, cranial nerve exam it is, am I right? Yeah. Great. Well, we are really glad to see you here. So, you're very welcome. Please come in. And you can sit right here in front of me so that we can have our exam. And before we start, I will just ask you a few control questions. First, let me confirm your personal data. So you must be... Okay, great. Thank you. Well, now your last name is... Yes, exactly. Your email address... No, I believe we have a different one. Maybe it's your previous one. So could you please spell the new one? Yay, exactly, good. Right. Okay, fine. And now your phone number. Finally, your home address. Okay. Get your date of birth. Okay. Great. Good. Well, have you had any injuries lately or any kind of accidents? Any surgeries? Okay. Yeah, got it. Do you have any complaints regarding any systems? Like your... Yeah, it can be anything. You can tell me. So it's better if I know, just in case. Yeah, I'm primarily interested in your cranial nerves, but also if there is something even related to digestion or other stuff, yeah, you can also tell me. Yeah, then I'll be able to address you to another doctor who can actually work with these kind of issues, but still, yeah, it's fine. So, our body is a complex system, it works all together, yeah. Okay, and how do you usually feel in the mornings? Right after you wake up. And how many hours of sleep do you have? You can do better, I believe in you, so yeah, of course, the more the better actually. Yeah, I'm not speaking of 10-12 hours, but at least 7-8 hours is a must. Yeah, there are some people who would say that 6 hours sleep a night per day can also be enough for them, quite sufficient, but well, for now science still believes that at least 7 hours, yes. That will do good to you. So, and I believe that there is nothing really urgent you have to do. So, I guess you can fix your schedule. Well, I hope so. At least you have to try, okay? And then let me know. You will share your results with me. Is it actually easy for you to fall asleep? Do you ever feel, I don't know, that it's hard to fall asleep for you, or it's do you ever feel lack of concentration in general? Okay, let me type it in. So that we don't forget anything. Okay, yeah, so you were saying, have you ever experienced insomnia? Yeah. What do you think when you can fall asleep, right? after you go to bed, what can it be caused with? Do you like using some kind of devices before going to bed? Yeah, sometimes this light from the screens can be a little bit distracting, so usually the doctors recommend not to use any before going to bed, at least like during 1 hour. You can read a book though, like a paper one. Yeah, but it's just better try to relax and okay. Well, maybe we'll actually send you to the sleep clinic later. But anyway, going back to your head, your neck, what about headaches? Do you ever have any? Some occasional ones? Okay. What about your, okay, like let's say sight, your hearing? Do you usually wear glasses or contact lenses? When was your last time, like your last appointment with an ophthalmologist? Okay, I got it. What about your skin? Is there anything I should look at? Okay, are you allergic to anything? Yeah, no worries about that. It's quite common. Okay, just a second. Okay, good. Well, I guess that we can start with taking your vitals as usual. What about your blood pressure? Do you have any issues related to that? Okay. Well, let's check your lungs and your heart. Please breathe in. Okay, good. Now you can breathe out right away. It's fine. I will tell you when I want you to hold your breath, okay? Okay, now once again, breathe in and out. Okay. Are you alright? Okay. Now once again. And turn your back. Yeah, you can just turn around. Good. Once again, and now I will ask you to hold your breath right there. Hold there. Out. Wonderful. Okay. No, it's just fine. It's alright. You don't need to worry about anything, so it's fine. Okay, great. Well, could you please follow the light for me? Okay, good. Do you feel alright? Do you ever experience any kind of dizziness? Okay, let me check your pupils. Good. Yeah, everything seems to be fine. Alright. Now give me a moment. So, I will just check the other one. And now once again. Okay, can you actually see me well? Are you sure? Okay. Yeah, after bright light it can get a little bit blurry, but not too much. and it shouldn't take long before it blurs out once again. Everything is just fine. Okay, great. Now, what if I close one of your eyes and will still ask you to follow the light for me? Okay, don't hurry, it's alright. Okay, just fine. Now with the other one. Yes. Okay. Is it a bit blurry? So I suppose I can have a look at these islands again. Is it okay? Now give me another moment. Okay, well, you know what I'm thinking? I will just put my gloves on and I will inspect this area around your eyes. It's alright. No need to worry about anything at all. You're safe here. And you can relax. So cranial nerve exam has nothing to do with some difficult tests and stuff. I'm gonna just see and check how your systems work, but it's not like some IQ test or some kind of exam, like, you know, like academic one, so it's alright. Okay, well, now, like I said, I would like to inspect this area around your eyes a little bit, okay? So, let's do it. Good. Is it alright if I press here? What about this area? What about if I touch this, like the bridge of your nose, right between your eyes? Okay. Good, wonderful. So now, since I'm here wearing my gloves, I will just touch all of your face, okay? I just want to feel if everything is alright. I can feel some kind of a lump here. So, are you sure that you didn't have any injuries, that you haven't had any injuries lately? Oh, okay. So you like bumped your head into... Oh, gosh. You gotta be more careful, right? Was it alright afterwards? Do you ever feel any headaches? Yeah, especially like since then. Have you had any symptoms you didn't used to have before? Okay. Are you sure? Oh, I'm so sorry about that. Well, no, it looks fine. I suppose it's like healing, probably, so it shouldn't take too long, but just in case, please do let me know. Just if something changes, you can call us anytime, right? Okay, now let me have a look at your jaw. Right there. Okay, that's wonderful. And your neck. Okay, your thyroid seems just fine to me, but have you ever tested your hormones? Okay. Yeah. No, it's fine. It's quite typical, but it's just good, you know, to have these checkups from time to time, and the same when it comes to blood tests and stuff. So we've got to do it like at least once a year, but if you do it once per 6 months, right? So it's just alright to be on the safe side, yeah? Sure. Okay. Well, now could you please let me have a look at your ears? Right. What if I press here? It's alright? Good. Well, so going back to testing your eyes. Now, would you please follow this kind of light for me? Just slowly with your eyes only. Please don't move your head. Good. Right. And now this way. Okay. Now could you please look at my nose and just tell me when the light leaves your vision, okay? Good. Right. Okay. Wonderful. Good. Now please look at the light. Okay. Now don't look at the light. Please look at my face. And just would you be so kind to let me know when the light starts flashing, but don't look directly at it, okay? So we're testing your side vision. It started flashing, okay. I don't want to expose you to this like kind of like a flashing light. It's fine. So as long as you can notice this change, it's fine. Okay, now on the other side, the same thing. Please don't look directly at the light. Look at me, look at my face, and just let me know when you see this change, okay? Okay, great. Good. Right, now please look at this light for me. Can you see it well? Okay. What about this one? Do they look same to you? Okay, slight difference in this temperature. Okay, great, wonderful. It's really cool that you can notice it. So, which means that you can differentiate between colors, at least to some extent. We'll check all the rest later. Okay, now, would you please follow this warmer pen for me? Yeah, this pen light is really convenient to use. So a lot of doctors have, a few of them. Please remember to follow this warm yellowish light. Okay, great. Now would you please look at my nose and let me know which side the light comes from, okay? From the bottom, great. From the top, wonderful. Okay, amazing. Now please look at my nose and just let me know which light appears in your field of vision, if it's this warmer light or colder white light, okay? Good. Great. Cold one. Warm again. Cold again. Okay. Now cold again. And now still cold. Good. Warm and cold. Okay, wonderful. Now would you please let me know how many times the light appears in your vision, okay? But please don't look directly at it, then it will be too simple. So I don't want you to get bored. Well, I really want to test your sight vision thoroughly. So just let me know how many times the light appeared in your vision, okay? You could count 3 times. Great, right you are. 3 times once again. Okay. Not exactly. Okay, now yes. Great. Three times. Okay, great. Now, would you please tell me if the light is inside this circle, this ring, or outside, okay? Out, okay. In. Good job. Okay. Wonderful. Good. Now let's try with this other light. Okay. Good. In. Okay. Wonderful, amazing. Now, please let me know. Oops. Sorry about that. So let me know if you can see the light through this magnifying glass. No, it's off. Okay. Now it is on. Okay. And what about now? You see it through? Okay, good. And what about now? No light. Okay, since I have this magnifying glass in my hand, let me have a closer look at your skin on your face. Okay. When was the last time you were seeing your dermatologist? Okay, well, I don't see any troubles, a bit of dryness and a bit of redness here and there, but overall it seems just alright. Okay, now please look at my nose and tell me how many fingers you can see inside this circle, okay? 2 of them. 3. Okay, now just 1. 2. Okay, now keep on looking at my face. Just let me know how many fingers you can see once again. Okay, sure. Okay, great. Now please keep on looking at my nose and just let me know when my fingers start wiggling on either side. Yeah, they're very similar to this color of the background. That's the point. Good, wonderful, you're doing great. Now could you please tell me what kind of shape is it? Can you see anything? What color is this triangle? And what about this one? Right. Is it the same kind of shape? And what about the color? Okay. So these two, do they seem to be similar in size to you? Okay. If I put them this way? Right. What about the color? If I put them this way, what color does it look like to you? Still more reddish. And on this side? Yeah, definitely got darker. Okay, great. Now, other colors. So please tell me, what color is it? Good. And this one, it's yellow too. Okay, any difference between these two yellow ones? Okay, got it. Great. Now, what about these and these? Okay. How would you describe the difference between these two markers? So this one is dark and this one. Okay, very good. Now, what about this color? And this color. Is the difference between them really big? What if I put them together this way? Can you still see it? How would you describe these two colors? Alright. Well, makes sense. Yeah. Okay, your answers are quite Accurate. Great. It's great news. You're not colorblind. Okay, now what about this color and this color? Are they totally different? Any similarities between them? Okay, are you sure? Great. Good job. You're doing so good. Okay, now what color is this? Great. Now let's find some random one. What about this color? Good job. And now this. Alright. Yeah. Now this color. I'll bring it closer so that you can see it better. Maybe under this angle. Okay, good. Right, you are. So now some more color blindness tests, just to make it really thorough. Okay, so now what can you see in this picture? Okay, yeah, you can see some circles, so for sure. Can you see anything inside them? Okay. What about this one? Wow, amazing. Yeah, that's a very good result. Now, let me check your sight. No more color blindness tests, so that's kind of obvious that we don't have any troubles with that. So could you please read this line for me, right under the green one? Okay, and now the next one, please. Yep, that's right. Good. And now let's read the very last one, the very bottom one. I have the same kind of chart behind me, but this one is just a bit more convenient to use. Good job. Okay, you are doing great. Okay, well, now let me type in the results. So the eye exam is done. It's really good, extremely good. Okay, well, now olfactory. Yep. So could you please take a sniff, take a smell of this one. I have some testers right here next to me, and I'll just put it this way, okay, so that you can smell it. Okay, so what does it smell like? Ooh, are you sure? Almost. Let's try another one. How do you like this one? Yeah, lemongrass. Wow, that's so accurate. I wouldn't expect it. Good job. Okay, now one more. Please take a sniff. Okay. Good job. Cinnamon it is. Now let's go back to this one, okay? Good. So what does it smell like to you? Yeah, you're right. Cedar. Okay. Good. Now the taste. So I will use these sticks. So would you please stick out your tongue for a moment, and I will just drop tiny amounts of this syrup onto your tongue. So now you can take this taste, try it, don't hurry, it's alright. Okay. Actually, yes, right here. Yeah, so this is something like these cacao beans, something like chocolate. Whatever your answer will be correct. Good. It's the tastiest one, to be honest. Now, the other one. Okay. So, okay. Good. Yeah, this one is not as sweet, you're right. Grapefruit, right, yeah. So it has this like sour, sweet, and a little bit of bitter notes to it. Exactly. Okay, wonderful. Good job. You're doing great. Well, in general, when it comes to the sense of smell and taste, do you ever have any kind of confusion? It's all right. Good. Yep. I'll put that in, put it in. All right. I know that many people, after coronavirus, they would lose their sense of smell and taste, and for somebody it was like partially recovered. And while some, like we do still have some patients who still cannot fully perceive the smell and the taste. So yeah, that's why I was wondering. Yeah. No, I totally get it. It's fine. It happens. Yeah, unfortunately. I mean, you can still train it. You can still practice. Try to get it back, but yeah, sometimes it happens. Okay. Well. Now your sensitivity check. Okay, you'll close your eyes and I will just touch your hand really slightly, so you will simply know when you feel me okay, basically like touching your hand, poking it really slightly. Okay, so close your eyes please. Good. Wonderful. Right here. Good. And now just tell me how many strokes you can feel on your skin, okay? Good. 3 times. 2. Good. Okay, well, great. You're doing good. And now let's make it a little bit more complicated for you. So I have this tool. It's quite sharp. Don't be afraid. It's all right. It won't be that painful. It won't be that bad. I will poke you with it really, really slightly. So see, I can do it with myself. It's not painful like at all. I promise. It's fine. Well, at least if I don't press too hard. Okay, and then I also have a brush. Obviously, I guess that's, you know, how the brush feels like on your skin. So your task would be simply to let me know if it's this sharp tool or the soft brush, okay? As you see, nothing too challenging. Okay, it's fine. Let's do it. Okay. Yeah, sharp again. Good. Soft brush. Okay, wonderful. Now, soft brush again. What about now? This sharp tool. Great. Now let's try to do similar thing with your face. I will use brush only, no worries, no sharp objects around your face. But I might, you know, like we can make a few strokes. So once again, just let me know how many you can feel, okay? Right on your face. Good. Okay. Great. Three times. Okay. Great. Now good job. And what about now? Once again. And what about now? Good. Okay. Well, so sensitivity is just fine. Now, let me have a look at your throat and your mouth for a moment. So we've checked your olfactory nerve, but you know, just I want to inspect everything really thoroughly. Okay, so open your mouth once again, please. Great. Now, could you please stick out your tongue? And now say ah. Good job. Okay, let me use my spatula for a moment. I won't press too much, so it's fine. You're not gonna feel any kind of discomfort, okay? Good. Okay, now let me have a look at your nose. Could you please put your chin up a little bit? Good job. And now let me have a look at your ears, right? I have already examined them with my hands. Okay, so now good. And this one, okay, your hearing. Do you have anything you'd like to discuss with me regarding your hearing? Okay. It's alright. Yeah, I'm listening to you. I'm all ears. I just want to put in the previous results, but it's fine. It's okay. Yeah. So you're hearing? Okay. Yeah, it's good. Well, you know what I'm thinking. I do have this tuning fork with me. but I do remember that we used it before, and I can see on your data, on your profile, that it wasn't that long ago when you had your actually like really like specific hearing test specifically. So I guess that it doesn't make sense to use it today. We might do it during our like specialized hearing test that we have. So I can see that like in around a week or so, right? Okay, good. So for now, let's just check your hearing on a really like basic level, okay? That's fine. So I will just make some noise and you will tell me which side it is on, but for that you have to close your eyes. Okay, good. Wonderful. Now on both sides. Okay, great. Now what you have to do is to count how many snaps you can hear, okay? Okay. 3 times. Just twice. 4, okay. Okay, good. 5 times. Okay, so you're also paying attention. That's great. Okay, now please just let me know what kind of sound it is, like what material you think it is, like what does it sound like, okay, what it reminds you of. Please keep your eyes closed. Paper. Okay, great. Now wooden chopsticks. Okay, great. Now some plastic. Okay. Oh, great. You're actually doing good. And now brush on the skin. Okay, great. Wonderful. So now I will create some background noise and just tell you some words, maybe some numbers, some random stuff, and you will just tell me what you heard me whisper. Okay? Okay, good. Microphone. Candle. Hazelnut. Almond. Oatmeal. Oatmeal milk. Soybeans. Glasses. Keyboard. Percussion hammer. Okay, great. Doing good. And speaking of percussion hammer, so we've got to check your reflexes. Okay. Are you feeling all right? It's just like it's been quite long, more than 40 minutes into your cranial nerve exam, so you know, some people can get a little bit tired and some people can get bored sometimes. Well, I do believe that you're not, so I was just like asking if you're all right. Maybe you'd like some water, maybe there is something else I could get you. Okay, are you sure? It's fine, it's all right. If you feel that you need anything, like some like a glass of water or something else, just do let me know, okay? I hope so. Please, like, feel free to tell me. You're my guest. Okay, so now your knee-jerk reflex. Could you please put one leg over the other one, just like that? Bend them together. Good. Now switch them, please. Exactly. Okay, wonderful. Now your wrist and your elbows. Okay. Now your chin. Slightly, really slightly. Okay. Fine. So, and your feet, I believe. It's alright. No worries. Good. Good job. Well, it's fine. Well, I'm really glad that everything works. So now, would you please follow the tip of the hammer just with your eyes? Good job. Okay. Now, would you please straighten both of your arms, and with one hand, with your pointed finger, just reach your nose. Now close your eyes, please. Yeah. Okay. Oh, great. It's fine. No worries. Now with the other one. Good. Good job. Now, would you please reach my hand with the opposite one? And now with the same one. Exactly. Now my other hand. First with the opposite. And now with the same one. Okay. Okay. Great. And now, would you please shrug your shoulders for me? Good job. Now shrug your shoulders, raise them. Don't let me put them down. Okay, it's fine. Yeah, I just want to check if you can resist me well, so how you can control your muscles, your reactions and everything like that. Okay, now would you please raise your eyebrows as if you're really, really surprised by something? Good. Now would you please frown as if you are angry at me? Okay. Puff your cheeks. Good job. Now would you please clench your jaws? And don't let me put down your lower jaw. Okay. Good. Now would you please give me the widest smile possible? Aw, you look really cute when you smile. Okay, great. Now, would you please just like put your arms like that? Okay, also please don't let me move them. Okay. Okay, great. Great. Now tilt your head to this side. And to the other one. All right. Do you feel dizzy when you do these movements with your head? No. Good. Okay, let me type it in. Good. Maybe you have any questions you'd like to ask me? Are you sure? Good. Okay. Wow. To be honest, like I'm totally satisfied with what we've done and with all your results. So everything is just fine. Like that's what I thought, you know. I didn't expect anything to go wrong, but still it's really, really great that you have these appointments regularly, and I think it's really, really cool that you care about your health. So it means that you'll be able to prevent any kind of disease before it's emerges, before it gets too late and stuff. So it's really cool that you handle all these things like really seriously. So let me add some more data. Good. All right. Would you like to get some rest, maybe? Yeah. Okay. We can totally, help you get some good rest. Yeah, so, yeah, we can leave you right here if you feel comfortable in that armchair. It's quite cozy, you know. I'll bring you the blanket. Yeah, so that you don't freeze. And you will be able to get at least an hour of good sleep. Yes, I have that option. I'm just kidding. I mean, like, the next appointment was cancelled by the patient, so it's totally fine. I'll go get some stuff and I'll be at the reception. So when you feel energized enough, yeah, just let us know that you're leaving, and like, it's fine. Take your time. It's okay. So I need to print some more stuff, okay? And now you can just close your eyes and try to like fall asleep, okay? At least like take a nap. And I'll just print some more stuff. Okay. So to process some of your results, and later we will send everything to you by the email, okay? Great. I hope it's not bothering you, the typing sounds, no? Okay, good. So you actually find it quite relaxing. Many people do. Yeah, exactly.